Hello, good evening. Welcome to Ubuntu channel, and this is Ubuntu channel Zambia, and we are live on Ubuntu, and we are bringing you the health zone. Now, this program comes every Monday at 20 hours, and we apologize for coming a bit late. And guess who is my guest tonight is Dr. Maseka, all the way from UTH Women's and Newborn. Good evening, Doc, and welcome to the program.
Thank you so very much. Good evening, Ruben. Good evening, everybody.
Thank you very much. Those who are watching us, don't forget to share this broadcast. Call your neighbor, call your family, because this topic tonight is going to interest you and you're going to learn a lot. Doc, you've been missing in action on Ubuntu. Welcome back to Health Zone.
Thank you, Ruben, because you didn't call me. So, but thanks. It's always great to chat with you and to sort of like chat with everybody else. It's a great opportunity, really. Thank you.
Thank you very much. The last time you came here, we were talking about the last topic was on fibroid, Doc. Hope you remember that. And we had a good response from the people. They appreciated the program, and I just wanted you to get that feedback from the people. They enjoyed the program, actually.
Thank you. No, I'm grateful. I'm so grateful, really. Thank you. Thank you so very much.
Thanks, Doc. Today's topic, Doc, is interesting. We're talking about infertility, and it is one of the issues, like one of the causes of divorce in our land today, and it has also brought like GBV or violence in homes. This is an important topic, Doc, and I want you to help us to understand what infertility is.
Okay, sure. I'll definitely do that. Well, I like the part where you brought in and say that infertility has brought a lot of issues around marriage, just not just divorce, but we've seen issues around a person being unfaithful. Sometimes it's not just a male. Unfortunately, sometimes the female can be the one who's unfaithful to the partner, or the male may be unfaithful, or they may want out. And of course, we've noted with the rising number of gender-based violence, which is specifically in this case would call it intimate partner violence. As such, the ministries when looking at infertility itself, we prefer seeing a couple. We don't want to see, for example, you, Ruben. I don't want to attend to you alone as Ruben. I want to see you and your wife. The reason is this: because of the stigma that infertility has, I want to talk to you. I want to talk to your wife. I want all of you to understand, and to understand that the journey to having a baby may not be an easy one. All right? So just to sort of like define what this infertility that we talk about is infertility is the inability of a couple to conceive following regular, penetrative, mark my words, I'm saying the ability of a couple to conceive, the inability of a couple to conceive following regular, penetrative sexual intercourse for a year and above. Of course, there's special criteria for those that are above the age of 35. We may consider it from 6 months and above. But those below the age of 35, we consider from a year and above. That's what you call infertility. So if a couple has one episode of sex in a month, and they come that, no, my wife is not conceiving, does that qualify? Is that regular? So with infertility, there has to be an aspect of it must be regular, penetrative sexual intercourse. And after having this, and if you're not impregnating your partner, then yes, we say there's infertility there.
All right. Doc, from your definition, you talked about a couple failing to have a child. So my question is this a problem for a man or a woman? Because most of the times we've seen it in our culture where if there is no child, like in a marriage or in a family,
Yeah.
most of the
Yeah.
time the blame goes to a woman. So make us understand, is it a problem for a man or a woman?
Okay. Well, our culture is in such a way that not just our culture, actually, even the Western world, also, you see it with, I'll give a typical example from the Bible, right? From the Bible, I'll start with from the Bible, you note that it was more like Sarai couldn't have a child, isn't it? So
Yes.
the Bible was saying Sarah couldn't have a baby, but is it true it was Sarah who couldn't have a baby?
No.
Okay, there's that other story. I can't remember the names, but I think the mother to Samuel or something like that. Um,
Hannah.
Hannah, yes, she too couldn't have a baby. She too couldn't have a baby, and what came out was like she couldn't give the husband that baby. So the same trend, actually, you see it amongst African countries, not just Africa. I mean, not just Zambia per se, but a number of African countries. Our culture is that if there's no baby following a marriage, the one to put the blame on is a female. But is that true? Is that true
No.
that if a couple does not have a baby, it means the blame should go on the female? Not really true. This is because it takes a man and a woman to create a baby. Yeah, it takes a man 50%, a woman 50%, both come together and they make this baby. So really, when there's no child, it's not the woman to blame, it's not the man to blame either. You understand? But it takes two to have a baby.
All right. Then, Doc, one of the issues that we see in our culture is that every time a couple get married, we see maybe after 2 or 3 months, people knocking on their doors. What's happening here? We can't see
When are you
a
having a
baby.
baby?
Yeah, exactly. So, at what point, Doc, do you want people to go and knock there? Because you said at least a period of 1 month. At what point can the couple get worried and say, I think we have this problem of infertility?
First of all, it should not be the business of anybody to find out if this couple is having a baby or not. I think it's none of anybody's business. It's the couple that decides. The couple decides when they should have a baby and when not, when they should have their firstborn kid and the second-born kid and things like that. And actually, this is one of the things that contribute to infertility stigma. You know, you've heard of infertility stigma. Some of the things that contribute to it is you find, okay, it could be, let's assume that the couple has been trying and the baby's not coming, and you keep flashing it in their face. Oh, it's Steven Junior. When is Junior coming? It's none of your business. A man is more than I mean, a father. A man is more than just a father. A woman is more than just a mother. You understand? Like there's more to being a woman than just having kids. There's more to being a man than just having kids. Of course, kids are supposed to be a blessing that comes from God, isn't it? That's what the Bible says. So as to when a couple should have their child depends on the couple, when they feel like they want to have a child. That's the more reason why I do get couples that would come, maybe they've been married for, say, 3 years, they come to seek for help because to them, they started planning for the baby in their second year of marriage, and now they think, okay, we've been planning for a baby, now it's been 1 year or so and no baby is coming, we need help. But I've also met couples who 6 months down the line, there's no baby, they come to you and say, look, my wife is not getting pregnant, what's happening? So really what determines when a couple has a child is the couple. They decide when they want to start having a family, and that should be none of our business as friends, as of course even parents or people around them, because that's decisions them themselves should be able to make.
Oh, thank you very much, Doc. Now let's
Sure.
help us to understand now, Doc. Are there types of infertility, or maybe infertility is just the same?
Broadly, we classify infertility as primary and secondary. Primary infertility is if a couple has never had a child, or they've never had a pregnancy, whether that pregnancy went to term where they have a baby, or maybe it didn't go to term, it was a miscarriage, provided there's never been conception, it's called primary. Now, if conception has occurred before, whether there's evidence of a baby being there or indeed a miscarriage, we call it secondary. So typically you get sometimes couples that have been married for a while, they've got maybe 4 kids, they're trying to have their 5th child and they can't get the baby. And this is now like maybe, depending on age, of course, it's maybe over a year and the baby can't come. So that couple, you say they've got secondary infertility, and the causes, by the way, are different. Then you can also have a couple, they've never, none of them, the man has never, no history of impregnating, the woman, no history of impregnating, getting pregnant, sorry. So both of them, they've never really been that history. That's what you call primary infertility. And besides the broad classification, we also classify it based on cause. Yeah, based on cause. What I mean is this: if you look at the what do you call this? If you look at the reproductive system of a female, you can use that actually to classify it. So we can classify infertility in terms of fallopian tube causes. That's where we talk of things of tubes being blocked or whatnot. You can classify it also in terms of unexplained infertility. This is where the tubes are not blocked. You can't find a cause whatsoever, but this couple, the female issues are normal, the man issues are normal, so that we call unexplained. Of course, on the man, you've got things like maybe things around sperm production and things like that. So yes, but broadly they're just 2, primary and secondary. The other ones are really just to help in terms of management.
All right. Thank you very much, Doc. And to our viewers, don't forget to share this broadcast to as many people as you can. And you can also type in your questions in the comment box, and we'll be able to read them here with Dr. Maseka live. And Doc is at Balikuchalo, Doc. We can even just see. And also share the link with you, that you'll be able to come in the studios live and join us with Doc. And then you can ask your question or contribute concerning infertility. Now, Doc, tell us, a couple is made of a man and a woman. So either of them can have a problem, or both of them can have a problem. So let's start with a woman. What causes infertility in a woman?
Okay, so in the woman, now, first I'll answer it like this. Broadly, 85% of infertility is as a result of preventive causes, which is typically the infections. So here, that's globally. Globally, the 85% of infertility is because of infections, typically the chlamydia and the gonorrhea. Now, this might be interesting, actually, to note that someone can have gonorrhea and they don't have symptoms. So gonorrhea can be with someone and it's symptomless. Like, you don't know. Usually what causes people to come to the hospital is they would not, maybe they're having this discharge that is failing to stop. Then they say, oh, there's a problem here. But imagine you have gonorrhea and it's not showing you that there's gonorrhea. So you find that the patient, someone will not come to the hospital. And then that now will result, untreated STIs, typically your gonorrhea and the chlamydia, result in blocked tubes. Yeah? So the blocked tubes now, of course, when the tubes are blocked, we expect the egg, which is supposed to move from the ovaries through the tubes to the uterus, not to move. Yeah? So infections are one. Besides infections, we've also got masses. For example, when I say masses, what I mean is things like the fibroids, especially the ones that are submucosal, the ones that are just beneath the lining of the uterus. Those are problematic. Those ones, typically what they do is, at a point when a baby is supposed to implant, they predispose to miscarriages. Now, imagine these fibroids are at the level of the the fallopian tubes. They are blocking the tubes. Okay, so the fibroids can cause blockage, which can also result in infertility. Besides that, we have also issues of surgery. There are women who've had surgeries around the uterus, especially previously, what we call dilatation and curettage, DNC, was a very common practice following miscarriage. So you find as they're scraping off the uterus, a woman will end up developing a scarring of the uterus that can cause infertility, inability to conceive. And of course, there are things like drugs that can cause someone to fail to conceive. Things, for example, like lifestyle, obesity, for example. How does obesity cause one not to have babies? Studies have shown that with women, if you have a weight, you're overweight, you're obese, it affects your ability to ovulate. Now, for your egg to be released, you need to ovulate. So if it affects you to ovulate, it means that this woman will be having her menses, but not ovulating, what we call an ovulatory cycle. Okay, and of course there are conditions like PCOS, polycystic ovarian syndrome. Typically, people that have polycystic ovarian syndrome tend to suffer from infertility. Them, it's issues of anovulation, and also, of course, issues of the hormones that different hormones that are in different proportions. Yeah, that's on the female, and of course, sometimes it could be because of surgery. Yeah. Some people have had surgeries, and that have caused them not to be able to have babies. For example, if you had surgery where they have to remove your ovaries, it means that you not ovulate. Besides that, also certain infections like TB of the ovaries, TB of the pelvis, conditions like endometriosis, those can result in predisposing to infertility. Then, as well, on the man, we have issues around infections. Commonly on the man is infections, and also your work, the type of work exposure, environmental causes. Yeah.
Doc,
If your
explain
work
more on that.
involves you doing a lot of
I'm worried now when you say of my work. I need to know whether I'm at risk or not. Tell us more,
oh,
Doc.
okay, all right. Yeah, so of course, environmental factors. Mostly we're talking about metals. Those that deal with a lot of metals and whatnot, they tend to affect the ability to have children. And we have these things like drugs like alcohol. Alcohol can actually, alcohol contributes a lot towards causing infertility in both men and women. Besides that, we've got caffeine. Did you know that your caffeine found in coffee, in your Coca-Cola, in your whatever, that also can can contribute to causing infertility. And also for men, other things that may play a role are issues of erectile dysfunctions, sexual dysfunctions. Like if someone has erectile dysfunctions or they've got pre-ejaculations, all those things can make this couple fail to have babies. So they're a lot.
All right, thank you very much. We'll come back to those because we'll be talking a bit of the main treatment. But before we do that, let's say this couple had a child, okay?
Yeah.
They had a baby. Then
Yeah.
they want to have a second baby, but I've been trying for some time. So uh, can we say that now after having that baby, can we comfortably say now after having that baby, this couple they've become infertile, they can't have another child?
So let's assume this couple is 35 years old, 36, 40 years, and they're trying to have a second baby, isn't it? And they've been trying hard. So if they're trying to have their second baby, they've been having regular sex, and this sex is penetrative, by the way. Yeah.
Yeah.
They've tried that for over 6 months because they're above 35. They've tried that for over 6 months, and they're not having their babies. Then we'll say that they are having secondary infertility because they've got a child. It's no longer primary. It's secondary infertility. So then we'll have to investigate them to really find out what's causing the secondary infertility. Yeah.
Oh, all right. Thank you very much for that, Doc. Now, let's look at the signs. Are there signs that a woman can pick and say, I think I've got a problem of uh, I'm not fertile?
Well, it's really difficult. It's really difficult to tell that I'm not fertile, because remember, uh, when you're looking at issues around fertility, what will make someone know that I can have a baby? When they see their periods, isn't it? When they see their periods, they can say, oh no, because I'm seeing my periods, if I had sex, it means I can get pregnant. But what people must know is that there are two cycles that happen. There's what you call the menstrual cycle, and there's what you call the ovarian cycle. The ovarian cycle works together with the menstrual cycle, occurs almost at the same time. So it's possible someone can be having menses and not ovulating. Those are the cycles that we call an ovulatory cycle, meaning she's not ovulating, but she's having her menses. So
So, Doc,
imagine.
you mean they're having their menses, but the egg is not coming out, right? Am I right?
Exactly. The egg is not coming out. She's having her menses, but the egg is not coming out. But see, the egg is microscopic. You can't tell, isn't
You
it?
can see.
For a
Yeah, I can
woman,
see.
as long as they see their periods, they know they can get pregnant. Even when they're counseling them, when they attain the age of periods, they tell them, no, if you sleep with a boy, you get pregnant. But now, clinically speaking, it's not just the menses, one must be ovulating. So it's difficult to tell if someone cannot get pregnant. Of course, there are certain conditions that are inborn. Those are the ones where you can tell. There are conditions that people are born with, where they, because of that condition, they cannot have children. For example, there are people that have conditions that will make them not have hormones that are needed for you to become to have your menses. They will not have the estrogen, for example. So this person will not even have breasts, but they are maybe 20, 30, 40 years old. They don't menstruate, they don't have breasts, they don't have secondary sexual characteristics which come as a result of estrogen. So for those, yes, you can tell when they're young that this person, because it's a genetic condition that they have, definitely they will have issues of infertility. But in a young girl that's able to menstruate, usually difficult to tell.
All right. Thank you very much, Doc. Let's look at the possible treatment for these people. They've tried regular sex; it's not working for them. What are some of the many treatment for this infertility?
Well, so treatment of infertility is broad, like I said. It depends on cause. So really, the couple must be investigated. Once investigated, we'll get to know what the cause is. Once cause is known, then it's tailored in such a way that you treat the cause. For example, if you're dealing with a couple that has maybe problems with the semen, problems with the sperms, yeah? There's a test that we call semen analysis. It's a lab test. It would give us the parameters. How are the sperm? How's the sperm count? How's the concentration? How's the volume? How's all these things? We look at those parameters. Sometimes they get to be deranged, where you find the sperms are not moving as fast as they should move, or perhaps the normal ones are not as many. So sometimes you find that it's just a matter of an infection. So you treat that infection and they're back on course. The parameters become normal. Yeah? Same with ovulation. For example, a woman can have an ovulatory cycle, isn't it? So from your assessment, you note, oh, this woman is having an ovulatory cycle because of excessive exercises. Did you know that excessive exercise can actually make an ovulatory cycle, meaning you're having your menses, but you're not ovulating? So then, if you notice that's a problem, what does that mean? That means that you just have to tell the woman to stop excessive exercising and she'll get her pregnancy. Or if it's obesity, you want her to have a normal weight. Now, normal weight for conception, normal BMI for conception is between 19 to 25. That's a normal BMI that people should have. So sometimes it could be blocked tubes. So if it's the tubes that are blocked, you look at, can you unblock the tubes? What we call tuboplasty, a procedure called tuboplasty, where you try to unblock the tubes and all. So of course, in short, what I'm just trying to say is that infertility treatment is dependent on the cause. What is causing this infertility? So you have to investigate them and find out. Of course, there are those that you do all your tests and all the tests come out normal. Those are the ones we call unexplained infertility. Those with unexplained infertility, the option that they have are options like IVF. That's what they have. That's the option that they have. Or if a man has no sperms, it means that that man will not impregnate his wife. So for such a couple, they have
Doc,
other options that they can actually try to look at.
Doc, my viewers are saying IVF. What is it? Is why you put a fertilized egg in a woman? Is it?
So yeah, that's in vitro fertilization. So they fertilize the egg and the sperm outside, and then later on, depending on the stage, they will now put this embryo into the woman.
Thank you very much to our viewers. Don't forget that you can participate in this program by typing your questions in the comment box, and also we've shared the link with you in the comment. Just click on the link and you can join us here in our studios. Before we take questions from our viewers, Doc, now I know that I'm not fertile, or we're facing the challenge of infertility. Can diet help us sort this problem?
Can diet help with infertility?
Yeah.
Infertility.
Yes.
All right. I'll say yes or no. I'm trying to be like a politician. I'll say yes or no. Why am I saying yes? Here's why I'm saying yes. Did you know that there are couples that stay for maybe over a month, no sex, and the reason could be maybe the woman, there's no arousal, the man has no arousal, such things, sexual dysfunctions. So there are foods that can help to boost your sexual appetite.
Sorry, Doc. I'll allow you just to repeat what you said, because there was a breakup in your network.
Yeah, I saw that as well. Okay, so what I'm saying is that I'll answer this one like a politician. I'll say yes and no. Yes, in the sense that there are foods, what you call there are foods that stimulate your sexual appetite, natural foods. Yeah. So if you're having issues around sex and you've got these foods that can stimulate, you get those foods, you eat them, your sexual appetite will be okay, and then you'll be able to have your coitus with your partner, isn't it? So in a way, it will help you. And also there are foods actually that help with like foods rich in certain vitamins that are good for the sperm, that people can go there. The foods that are good for sperm, there are also foods that are good for egg. And besides food, the other thing that they can do is actually, if you're smoking, lifestyle modification. Yeah, you live healthy. If you're trying to have a baby, stop your alcohol, stop your smoking, reduce, or you can reduce. If you can't stop, you can reduce. And also issues like caffeine, you have to reduce those. For men, for example, sperm production. I think there was a time when people were talking about not wearing tight, is it tight pants or those boxers for guys, because sperms don't want so much heat. So those are some of the lifestyle modifications that one can do. But yeah, of course, food has a way it can help, but it's limited. Yeah, it's limited somehow. And what's important is just to ensure that when you're trying to have a baby, be in the best health that you can be. Yeah, eat right, eat the right food, eat a balanced diet, and yeah, drop what you can drop.
Thanks very much, Doc. Does age have any impact on someone's fertility?
Age, yes, it
Yeah.
does. It does. Age actually cuts across the board. Initially, what we used to get mostly people talking, no, it's the ladies that are affected only, and the men are spared because they still have. But actually, truth is, even the guys are affected. So you find for the female, after the age of 35, what you call advanced maternal age, after the age of 35, there's a lot of changes that go on at the level of the eggs, for example. Okay. Also, besides, the quality of the egg goes down. After the age of 35, the quality of the egg goes down, and also the ovarian reserve, what we call the ovarian reserve, the many eggs that you have reserved, goes down. But that is not to say that you will not meet a 35-year or a 40-year-old with a baby. You will meet them. You meet even 40-year-old, 41-year-old with a baby. But globally or on a majority, you find that their ability to conceive also goes down with age. That also applies with the men. Their ability to impregnate and whatnot also goes down with age. Of course, we've heard of 80-year-olds that impregnate, yes, but just the ability and the quality of the sperm as well gets affected with age.
Okay, so this couple comes with infertility to see you, doc. What's the first thing that you do, or what's the first thing that you begin to ask this couple?
First, I want to get the history. I want to know them. I want to know this woman, who is she? I want to understand her cycle. I want to understand a lot of things really about her. Also, I want to know what she does. Does she take alcohol? The job she does. Has she had a child before? If she's had a child before, how long ago was the last child? Because you agree with me. For example, if I have two couples, one has a primary infertility for 5 years, and another one is a couple with secondary infertility for 5 years, I have more chances of a child with the one with the secondary infertility for 5 years. You understand? Eh?
Yeah.
Yeah. Now, among the ones, let's say the ones for primary infertility, here's a couple, two couples again. One, they've been trying for 3 years, and another one for 5 years or 8 years. The one who's been trying for 3 years, I've got a better chance of getting them pregnant than the one who's been trying for 8 years. You understand? Eh? So the
Yeah.
longer the period of infertility, the harder it gets to get someone to get pregnant. So, yeah.
All right. Now, doc, here is a couple that are facing this challenge of infertility. It's a newly married couple. They're
Yeah.
receiving pressure from people around. Hey, when are we seeing the junior? When are we seeing our grandchild? They and all that. And these people now are stressed. Now, my question is, can stress cause infertility?
Yes, it contributes. Stress contributes to inability to conceive. Uh, just like alcohol does contribute, so does stress contribute. Actually, stress contributes a lot. Even just those people asking a couple, when are you having a child, giving them stress, that already will affect them. You understand? If they were at 80% of having a baby, you start stressing them like that, they'll drop not down to 50%. Yeah. So really, for a couple that comes, you want to know them, and after you know them, based on what you discover about them, then you ask for some investigations to be done, and then thereafter treat them according to the results of the investigation. Stress is one of the causes of infertility. That's why you and I should not really get to want to know or bother this couple. When are you having? When is Junior? We can't hear. No, 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 no. You're stressing them. You're already giving them stress to, I'm sure themselves are already stressed. You don't want to add so much stress to them. Why not be that helping hand for them?
All right. Okay, that be that helping hand to them. Now, doc, that's a point where I wanted to bring in. How can we help these people that are facing this challenge of infertility?
Yeah. So infertility stigma is very real and it's very common. So the first thing to do in trying to help them is stop stigmatizing. Someone has no baby, it's okay. It's okay not to have a baby. Yeah. And
Mm.
by the way, those same people trying to have a baby, they've been bothered already by it. They're already stressed by it. You don't want to add more stress to them. So it starts with, don't ask, when are you having the second baby? When we can't see Junior. Just let them be. Maybe the only help, and issues of infertility are difficult to talk about or to start asking someone, oh, have you been to the doctor? Have you been? But the other help is information, like what you're doing right now, Ubuntu TV, giving people information. You're empowering them so they will know, oh, if we stay for a year and more and we're failing to have a baby and we are below the age of 35, it means we have to go to the hospital. We have to seek help. It means there's something wrong there. Already that's the help that you're giving them. And besides that, sometimes it's just making this woman know, for example, that look, it takes, being a woman is more than just being a mother. There's more to you. There's more that you can offer to the world. Even a man,
All right, you seem to have lost Doc.
The man should not be defined by how many babies he can have or how many women he can. Okay. You lost me there, right?
Yes, 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 yes.
Hi, Ruben. Are you able to get me?
I can get you loud and clear. So you were
Okay, all
explaining.
right. So I'm just saying that there's more to a man than having impregnating people. There's more to a woman than conceiving. So the woman must know she's more than just a mother. The man must also know he's more than just a father. And it begins with you and me. How does it begin with us? By ensuring that we are that helping hand. Sometimes it's even just being there, you're not talking about it, you're not bothering. When are you having baby number two? When are you having a baby? That's enough. Sometimes all you have to do is just listen to this woman. Let her tell you her tales. Listen to this man. Let him tell you what the baby is doing right now. Something. This is a public sensitization. You're giving them knowledge, which is power, right? So then they would know.
Yeah.
Oh, if we stay for a year below 35, it means that we need help. If we are above 35 and it's already 6 months, and it means that we need help. That's what you're doing right now. That's the helping hand I'm talking about. Yeah.
Thanks, Doc. I've got a question from one of our viewers who is watching us via YouTube. Is saying, Doc, awesome topic. When you say regular says sex, does it mean daily or something? Please explain.
When I said what? Regular.
Yeah, does it mean daily or what do you mean?
Okay, really, what is regular is dependent on the couple. Yeah. But in short, at least what I think on average, three per week, 3 times a week. Like if I want to 3 times a week, that is enough. But people have sex differently. But at least on average, if you can have you meet 3 times a week, that should be more than enough. Yeah, that's regular.
All right. I want to pick another question from our YouTube channel, and it's coming from Chavala Waya.
Okay.
He's saying, Doc,
Chabala, all
uh,
right.
yes, it says, Doc, what causes failure to conceive? Even yeah, the question has come on the screen. Say, Doc,
Oh, thank you.
what causes failure to conceive, even if you've had children before? So he's talking
Okay,
of,
thank
you
you.
said secondary infertility, right?
There, correct,
Yeah.
Ruben. It's secondary infertility. So, thank you, Chabala. So, what causes a couple not to have a baby even after they've had a baby in the past? There are a number of causes, my dear. Commonly, it's infections. Sometimes it could be stress, like Ruben tried to bring out. Stress is one of the causes of infertility. Sometimes it could be just the fact that this man, you know, that as men hit the age of 40, most of them tend to suffer from sexual dysfunction, commonly erectile dysfunction. And most men will not come to a clinic and tell you, look, I'm failing to erect. They hardly do that. They still want to be the man. But, so there's a lot of causes. And the best is to just go to a health facility and investigations are done. Based on the investigations, help will be rendered.
All right. I'm just speaking. We have a lot of comments here, Doc. Let me go to Mr. Jonathan M. Chipindami. Uh, Director, just beam that for us. The comment coming from Jonathan Chipindami. There you have it, Doc. It says, how easily accessible are these treatments in an event that a couple experiences infertility? And is all form of infertility treatable?
Okay, thank you, Jonathan. Thank you for that amazing question. So, how easily accessible? Well, we must actually, they say where if someone has done a great job, you thank them, isn't it? So now the
Yeah.
Ministry of Health has done greatly. On this one, they've done greatly on not only building facilities, but also ensuring that there are specialists in these facilities. What I mean is that most of the facilities, even in Lusaka, go to Chawama level 1, or now General Hospital, you'll find there's obstetricians there. Go to your Matero, go to Chilenja, you'll find them. So you don't need to flock to UTH per se. And of course, the obstetricians will bear some of the tests that we ask for. You may find that we may not have ability at the moment to do them yet as government institutions. That's where we ask sometimes our clients to do them from from other facilities, these private labs. And once they do those, of course, we see how we can help them. Now, where you've done everything that you can in terms of investigation and given the help that you can, and the couple is still not conceiving, that's where now issues of IVF or IUS, is what you call in utero insemination, IUS. There's IUS, there's IVF, there's ICSI. All those are different terms and they mean differently. But what I just mean is that you need to go on another level. You move from the level where we're just trying to give you drugs to do whatnot to another level. You understand? Yeah. So, of course, your help is there and easily accessible, especially in government hospitals. You are free to come to government, and most of our services are, you find specialized people there and easy to access, really.
All right. There's a funny comment here coming from Himba Mioba. Director, if you can get the one from Himba Mioba. It's a funny comment, Doc.
No, it's fine.
Yes. Yeah, there you have it. It says, I love it when docs say it is none of our business. Hope these in-laws who like troubling their daughter-in-law are listening.
I like you, Himba. I like you, Himba. You know, the month of June is Infertility Month awareness. Are we aware? If you look at, I did a lot of commenting on that because it's none of anybody's business. The couple is already stressed as it were. Why add more stress? You know, like, why add more stress? As if you're going to say, oh, okay, you have a baby and I'll take that baby I'll take them to school, I'll do this university. Let the couple plan. It's their pace. Yeah.
Okay, Mr. Chavala is back again with another comment saying, how possible is it for a woman? Want to see this, what it means? Okay, how possible is it for a woman who had had tubes closed to be opened again for her to conceive?
Okay, thank you so very much, Chabala. So, tubal blockage, which we call BTL, bilateral tubal blockage, is done as a way of permanent contraception. It's a method for permanent contraception. So we don't just routinely give it. We give it to patients that are saying, look, we are done with our babies. But of course, someone can be done with their babies today. A few years down the line, they feel like they want a baby. Can that be reversed? Yes. The tubes can be reversed. But what does that mean? That means that your tube will not be as long as it were, isn't it? Because remember, we cut. The tube will not be as long as it were. And actually, if that person was to conceive, over 85% of them will have ectopic pregnancies. So even the success, conceiving again becomes tricky. And when they do conceive, they have ectopic pregnancies. Yeah.
This is a pregnancy where the baby is not in the womb, right? But in the tubes. Am I right? All right, that's a topic on its own, Doc. We need to tackle that. I think we need to talk about that because our viewers need to to learn more about all these things. Yeah. Okay. Someone says communities need sensitization regarding this topic. Maybe just people can have empathy with those who don't have children.
Yeah, we there's a lot that we need to do to. It's difficult not to have a child. It's difficult. It's quite difficult, you know. So yeah, there's a lot of sensitization that needs to be done, you know. Yeah. Thank you for that comment.
Right. Let me check my other comments. Okay. Yes. Someone is saying, Doc, can contraceptives also contribute, like, for people to have this infertility?
Well, there are different types of contraceptions. If you're looking at the permanent contraceptions, typically we have two commonly in Zambia. That's the BTL and the vasectomy. If someone has a vasectomy, it's easier to like sort of like reverse the vasectomy, where you cut the vas difference for a man, than it is for a BTL. But even when a BTL is reversed, which is possible, there will be issues of ectopic pregnancies more. So therefore, I can safely say contraception does not really cause infertility. No, it does not. Those that consent to permanent methods are those who are telling us, look, we don't want babies anymore. We are done. So you can either cut the tubes for the man or for the woman. But as causing infertility, I can't really put that as a cause. No. Our contraceptive methods are very safe, tested not only for years, they've been tested, and they don't affect fertility. No, what they do is, in the moment when you don't want your baby, they'll prevent you from having your baby. But of course, amongst them, drugs like the Depo-Provera and the norepinephrine, the injections, the depots, those, when one stops taking them, because they sort of like affect ovulation, you find sometimes it takes a bit for ovulation to start, but it definitely comes back. Yeah. It
Right,
takes a bit of
we've got Lawrence. Hi, Doc. We've got Lawrence in our studios. I think he has got a comment or a question. Please go ahead, Lawrence.
Good evening, Doc. Can you hear me? Good evening, Doc.
Good evening, but you're breaking, and it's an echo, and it's breaking.
I don't know. Can you hear me?
Yeah, I can hear you.
All right, thank you. Doc, thank you so much for this interesting topic. I just want to find out, are there family planning methods that can lead to infertility of women specifically?
Sorry, I'm getting an echo, and it's sort of like it keeps breaking. Ruben, did you get what he said on your end?
Yes, I did. It's just the similar question like from asking you. He was asking Lawrence, maybe you can mute yourself. Lawrence, can you mute yourself? Okay, Doc, can you hear me? Can you hear me now?
I can hear you, yes, but your voice is not clear. It's like echo, echoing. So I'm not getting you clearly.
Yeah, I'm getting the same as well. But he was asking a similar question like I asked: can family planning methods cause infertility? All right, it seems to have a connection challenge with Doc, but to be able to come back so that we can finalize on this important topic that we're sharing tonight on infertility. We've seen its effects, and we've seen it. It's happening. It affects people that we know. It affects our relatives. From what Doc was sharing, she was saying we need to support such people, because we can cause stress if we're not supporting them, and that stress can also lead to infertility. So if you are joining us, this is Health Zone on Ubuntu channel. We come every Monday at 20 hours sharing different conditions, different diseases that affect you and me and our families, our relatives. Don't forget to share this broadcast. Don't forget to subscribe to our YouTube channel. Don't forget to follow us on Twitter, because Ubuntu channel is a channel for you. I am, because we are now, this program highlights different conditions, different health conditions that affect you and me. And we come every Monday at 20 hours to come and share on different topics. So every Monday, tune in at exactly 20 hours for you to catch Health Zone on Ubuntu channel. And don't forget, also we've shared a link with you, or you can, if you feel shy, you can't come in our studios, just type your question in the comment box, then we'll be able to read your comment box, your comment or your question concerning this topic on this here in our studios. I don't know if we have any comments, so that you can just go through the comments, like what people have shared. Hi, Director, do you have any comments for coming from people? Okay, so tonight I was joined by Dr. Maseka. Share the greetings as well, so me. All right, so Daniel is saying, why is she smiling? Because she was happy with the way we introduced her, and she was happy coming back on Ubuntu channel after some time. The last time she was here, we were sharing on fibroids, and we had a lot of people watching and commenting. Boaz Kasewa is saying, connected and watching. Thank you very much, Boaz, for joining us. Ubuntu always brings content that will entertain you, educate you. Jonathan M. Chipindami saying, watching from Lusaka. Thank you very much, Mr. Jonathan, for connecting to Ubuntu channel. Lance Sani is saying, watching with those big eyes like mine. Thank you very much, Lance, for watching Health Zone here on Ubuntu channel. Chibonta Julie is saying, watching. Thank you very much for watching. This is Ubuntu channel. This is Chavala what they're saying following. Thank you very much, Mr. Chavala, because some of the questions that you asked here, we asked Doc and she was able to respond. I'm sure you are happy and glad because at least it has educated someone here on the program who is watching us. Is there any other? If that's so, then this is where we need to close our programs. Unfortunately, Doc had a connectivity challenge. All right, I've got Himba who has joined us in the studios. Can we have Himba, please? Hi, Himba. Good evening, and welcome to Health Zone on Ubuntu channel. Hi, Himba. Are you there? All right, you seem to have lost Himba there. So if you are joining us, this is Health Zone on Ubuntu channel, and we are discussing on infertility with Dr. Astrida Maseka. She's a doctor that works at UTH Women's and Newborn, and she is a specialized doctor. She's done, she's a gynecologist and obstetrician. So she was helping us understand what infertility is. Doc, welcome back. You ran away from me.
Yeah. Today has been a day and a half, Ruben. Imagine I'm using another app, another thing. That one
Yes.
went off.
All right.
Yes,
so
please.
the question that Lawrence asked was similar to my question. He was saying,
Yes, yes.
are there family, are there contraceptives that causes this infertility? Or family
Well,
planning methods. That's what he said. Are there family planning methods that causes infertility, which was similar to what I had asked?
yeah. So, well, from the point of view of the government, the drugs that are offered there, you know what I mean, and the drugs that you get in a hospital, the drugs, those are safe drugs. So those drugs, no, they don't cause infertility, no. However, I'm not saying what I'm going to say is gospel truth. However, I've had a lot of clients that have come to me failing to conceive because they took this pill, you know, like a Chinese pill. Then I asked them, oh, okay, what exact name does this pill got? They don't know. Everyone tells you Chinese pill. I don't know. But I've met a number of women actually that have failed to conceive after that they come through. But as to what that is, I don't know. As to what that can, if that can cause infertility, I'm not quite sure. But I've met actually a number of them that will give you that history. I don't know. However, what I know is that the drugs that are in the healthy facilities are all safe. They shouldn't cause infertility. No, they don't.
Thank you very much, Doc. Please summarize it for us, Doc, what infertility is, what causes it, how someone can get help.
All right. So I'll say again, infertility is inability of a couple to have a baby following regular, mark my words, I said regular, penetrative sex. If you're looking at a couple above the age of 35, you say it should be from 6 months. You can say there's infertility. Those above the age of 30, below the age of 35 is from after a year. And of course, help is there, help is there, help is there. What you just need to do is when you are failing to have a baby, go to the hospital, let the doctor see you. They'll get a history. They'll then go on to examine both of you as a couple. They'll then go on to sort of like investigate you and then give you treatment tailored on your cause, what is causing the problem, and that's what they'll treat. So in a nutshell, really what we have to know is that help is there, infertility is there, and 85% globally, including Zambia, of the causes of infertility tends to be infective causes, which are not just preventable, but they're also treatable. And lastly, I'll say this. A man is more than just a father. What makes you be a man, Reuben, is not the fact that you can impregnate icon. You understand? What makes me a woman is not because I've got babies. No. A woman is more than a mother. A man is more than a father. And say no to infertility stigma. Chasila.
And those
That's
aunties
my
that
summary.
knock on the doors.
Pardon?
And those aunties that knock on the doors.
When those people are stigmatizing, they should stop. Report them. Report them as a couple that people are stigmatizing you. Stigma, saying no to infertility stigma, really. Don't knock. Don't knock. Be the help.
Thank you very much, Doc. Really, I've learned a lot on this topic, and I'm sure our viewers have also gotten something from this topic. This has been Ubuntu channel. This has been Ubuntu Health Zone, and we were discussing infertility, and I was joined by Dr. Maseka, a good gynecologist, and you can find her at UTH Women's and Newborn. Till next time, Monday, same 20 hours. It's goodbye from us.
Bye-bye. 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 Thank you. Thank you so very much. Thank you, Reuben. Thank you. Thank you.
Thank you.
All right. Bye-bye.